Yesterday, Mary and Joseph arrived at my office. Maria had just lost the movements on one side of her face. She had nothing else and she was diagnosed with Bell's palsy. Jose had a tumor removed from inside his head. He had been paralyzed for 2 years, but it did not improve any facial functions. Hey, do you think the treatment plan for both patients is the same? Understanding facial paralysis treatment today. Guys, we can't say that we are going to treat Mrs. Maria and Mr. Jose in the same way. When we talk about facial paralysis, physiotherapy is important initially because most of them, especially in Bell's palsy, as we talked about in this other video here, recover spontaneously, that is without surgery. Jose needs surgery as a year has passed without any nerve regeneration in his facial muscles, requiring intervention due to lack of muscle response. Facial paralysis surgery needs to be performed within a certain time frame because after denervation, meaning the muscle no longer receives nerve signals, the muscle begins to atrophy. And a surgery after 2 years, unfortunately, will not have any response. In the case of facial paralysis within 1 year, we typically opt for nerve transfer procedures or direct reconstruction of the facial nerve itself. In nerve transfer, we have these two options: the masseter nerve for chewing or the hypoglossal nerve, which is the nerve of the tongue. We make a detour of this nerve so that it passes to the facial muscles and the patient has an improvement in their movements. Alright, doctor, has it been a long time? Has this nerve transfer surgery not improved? Hey, what am I going to do? In this particular scenario, reconstructive surgeries offer a range of options. For instance, procedures like facelifts, eyelid surgery, gold weight usage, thigh muscle transfers, and even relocating the chewing muscle can be performed to enhance facial balance and mobility. Treatment for facial paralysis is individualized and not universal for all patients. Patients with a recent injury that has a chance of improving without surgery, initially physiotherapy, which protects the eye, avoids syngenesias, which are those movements of the mouth and eye at the same time, avoids stiffness, and even improves the outcome of a surgical procedure that may need to be performed in the future. Patients who have undergone physical therapy and have not had satisfactory improvement may require a surgical procedure, preferably to be performed within a year for optimal outcomes. Hey, did you go to the doctor and did he tell you that you already need surgery? Or did you spend a long time doing physical therapy and then found out you needed a procedure to reconstruct the function of your face? Leave it here in the comments. I'm Dr. Thomas Marcolini, a neurosurgeon specialized in facial nerve repair. If you like this content, like the video and follow my channel here.